Now we will study motor speech disorder. First, we need to understand about speech and motor disorders. Speech requires the integrity and integration of numerous neurocognitive, neuromotor, neuromuscular, and musculoskeletal activities. These activities can be summarized as follows. 1. When thoughts, feelings, and emotions generate an intent to communicate verbally, they must be organized and converted into a code that abides by the rules of language. These combined activities are referred to as cognitive-linguistic processes. 2. The intended verbal message must be organized for neuromuscular execution. These activities include the selection, sequencing, and regulation of sensorimotor programs that activate speech muscles at appropriate coarticulated times, durations, and intensities. These combined activities are referred to as motor speech planning, programming, and control speech processes. 3. Central and peripheral nervous system activity must combine to execute speech motor programs by innervating breathing, phonatory, resonatory, and articulatory muscles in a manner that generates an acoustic signal that faithfully reflects the goals of the programs. The neural and neuromuscular transmission and subsequent muscle contractions and movements of speech structures are referred to as neuromuscular execution. The combined processes of speech motor planning, programming, control, and execution are referred to as motor speech disorder. Motor speech disorders (MSDS) are a group of speech and communication disorders that result from a disruption in the motor control of the muscles used for speech production. These disorders can affect the precision, speed, strength, and coordination of the muscles involved in speech, making it difficult for individuals to articulate and communicate effectively. There are several types of motor speech disorders, with the two most common ones being apraxia of speech and dysarthria. This is a motor speech disorder characterized by difficulty planning and coordinating the precise movements necessary for speech production. People with AS know what they want to say, but they struggle to translate their thoughts into clear and accurate speech sounds. It's often caused by damage to the areas of the brain responsible for motor planning and programming of speech movements. What is dysarthria? It refers to a group of motor speech disorders caused by muscle weakness, paralysis, or incoordination of the muscles used for speech production. It can result from various neurological conditions, such as stroke, traumatic brain injury, Parkinson's disease, amyotrophic lateral sclerosis, ALS, and more. Dysarthria can affect the speed, strength, range, and rhythm of speech, leading to slurred or unclear speech. Several disturbances of speech neither clearly represent nor traditionally have been defined as MSDS. They are nonetheless neurologic in origin and distinct in their clinical characteristics. These deficits include, but may not be limited to, acquired neurogenic stuttering, palalia, echolalia, some forms of mutism, foreign accent syndrome, and aprosody associated with right hemisphere dysfunction. These disorders are which focuses on neurologic speech disturbances not typically categorized under the headings of dysarthria or apraxia of speech. Size and shape. The integrity of muscle, cartilage, and bone is important to normal speech. Injury, disease, congenital absence, loss to aging or paraplegia, teeth, or surgical removal of muscle, cartilage, or bone can alter speech. Other physical influences, such as abnormal variations in the size and shape of primary speech structures or the effects of systemic illness, also can alter speech in ways that exceed, mask, or exacerbate the effects of focal neuropathologies on speech. The reader's awareness of these factors is assumed, and they are not discussed further. Certain